My name is Natalie Dean. I'm an assistant professor of biostatistics at the University of Florida. I'm in the College of Public Health and Health Professions and the College of Medicine. So biostatistics is statistics applied to medical research primarily and epidemiological research. My research area is infectious disease epidemiology and vaccine clinical trial design. So I work with a multidisciplinary team of statisticians, epidemiologists, people who work in global public health. And we do lots of different things. We analyze data that's coming out of some of these outbreaks. We do modeling to understand sort of where the epidemic is going.
With your field being so much in a spotlight right now, what would you like people to understand about it?
So I think the most important thing to understand about epidemiology right now is that being able to really understand the disease relies on high quality data. And when we're working with a new disease, things are evolving so quickly that we don't always have the data sources we need to make the most informed decisions, but we're rapidly accumulating data, as quickly as we can. We're updating our, understanding constantly. So just understanding that it's an evolving situation, but that's just part of science.
What's it been like being on all these interviews? Like, what are some of the ones you've been on, and how, like, is it different? Is it?
I haven't had this much attention from the media before. Certainly when we worked on the Ebola vaccine, there was interest. Everyone's eyes are pointed squarely in the same direction because it's impacting our lives so directly. So as a result, there was a lot of media interest. So I've been talking to the Washington Post and Business Insider, New York Times, and Boston Globe, and a lot of different places. So just trying to get a scientist's message out there.
You recently got verified on Twitter as well. Has that changed the way that you're delivering information? And do you feel more of a responsibility to deliver this kind of information?
The goal is that we can't really control misinformation, but we can try and amplify good information. And but not much has changed since that verification. But you know, as long as I've been doing this, I have tried to be mindful, particularly recently, about making sure that what I share, I've read what I share, and that I endorse it, and trying to keep some level of professionalism at all times.
I was on your Twitter and there was the hashtag, I think it was I'm an epidemiologist.
Yeah, an actual epidemiologist.
An actual epidemiologist. Can you tell us about that hashtag and
Yeah.
why you started using that?
So the purpose of that hashtag was for people to share their credentials so that others can see, I have this specific training. I've worked on analyses of Ebola, Zika, dengue, HIV, amplifying that we have this particular skill that is worthwhile at this time. So I'm so fortunate to work with a great team here at the University of Florida, with Professor Ira Longini, Professor Young, and together, we formed a great team that's able to work on these high impact problems. And we're linked up with a large community of statisticians, infectious disease modelers, epidemiologists. And so, I've been able to benefit from working with this great group of people.
If there's one thing that you want people to take away from this talk with you, what would it be?
I think these are challenging times, but during the hardest times, we're able to see the greatest innovations. And so I think I've heard people liken this to kind of a wartime model where people from every sector are really going to need to come together. But I do think that people are incredibly innovative and creative, and we're going to see innovations in tech, and we're going to see innovations in supporting our most vulnerable populations. So, I really think, although it's incredibly challenging, we are going to see, a good side of humanity as people come together to fight COVID-19.